Hello, good evening. My name is Bisola Adeniran, and I will be doing my case presentation tonight on one of the patients that I saw at the clinic. My patient is a 40-year-old male African American. Actually, he's a new patient to the clinic and appears to be in a good, appearance. He appears to be a good historian. Patient arrived unaccompanied to the clinic, and the main uh, complaint or the chief complaint was that patient stated that he had noticed cough since last week, and now it has become more productive. Okay, so the history of present illness, patients arrives at the clinic with a primary concern of worsening cough that has now become productive. So he noticed his symptoms last week, and patient denies fever, denies pain, denies shortness of breath, and he stated this is the second week, and the cough has now become more productive, and he noted clear, loose flames when he coughs. He has been taking Mucinex as needed, and using humidifier with some improvements. Patient deny any pain or distress at this time, and no past medical history except that patient had appendectomy 3 years ago and was hospitalized due to that. And his immunization record is up to date. Patient has been vaccinated for this flu season, and also COVID vaccine is up to date. Patient is non allergy, denies food, seasonal allergy, and environmental allergy. The only medication listed here is the Mucinex, OTC 1200 milligram POQ 12 hours as needed. Social history. Patient stated that he's married with two kids, and patient admits to occasional tobacco use. That is, he smokes about one pack, in a month. So the patient denies alcohol intake or any recreational drugs. Patient stated that he drinks coffee every morning, and he works as a store manager at the local store. He also stated that he normally have 8 hours of sleep at night, and he has noted a significant increase in stress level due to his job, and his highest education is high school diploma. Okay, so family history. Patient stated that mom is 75-year-old with history of asthma, and dad has no medical history apart that. Dad also smoke. His father is a smoker for the past 25 years, and maternal grandparents are deceased, and with history of COPD. So the review of system. Patient denies fever at this time, but reports some fatigue. Patients admits to some nasal congestion, and patient denied sore throat or difficulty swallowing. Patient denies any palpitation, no shortness of breath at this time, but patient is stated productive cough with clear, loose sputum, denies any whistling, denies shortness of breath. GI system denies heartburn or reflux episode, and admit to fatigue and malaise. So vital sign has been checked, and temperature is 97.6, respiration 18, pulse is 68, blood pressure is 116/74, and oxygen saturation is 99, room air, no pain. The height of the patient 5'9" and weigh 180 pounds. So patient general survey. Patient appear as an adult, arrive at the clinic unaccompanied, and no pain, no distress. Is very, very cooperative and coherent. He answered all questions appropriately and in full sentence. Patient was able to ambulate, on a stable gait and independently. Physical exam. Physical exam looks great, apart from respiratory system shows that patient had even and unlabeled respiration. Rhonchi noted on lower lobes, and no wheezing, no crackles. Cough appears clear with slight yellowish sputum, and patient was able to ambulate independently with steady gait, and cardiovascular S1, S2 without murmur, no peripheral edema, and so based on my assessment, the differential diagnosis that I've chosen will be bronchitis, and I chose bronchitis based on cough and congestion. Bronchitis is the inflammation of the tracheobronchial tree, and the second one is pneumonia. No fever, no chills or pleuritic pain, only complaint of sputum production. Pneumonia is characterized by a new lung infiltrate present with fever and pleuritic pain. And the third differential diagnosis will be upper respiratory infection. Self-limited irritation and swelling of the upper airway with a cough and no signs of pneumonia. So the main diagnosis for this patient will be bronchitis. Is the inflammation of the lining of the bronchi due to virus and can be caused by allergen and leads to mucosal thickening with symptoms of cough, malaise, clear or yellow sputum. So so the plan will be initial diagnosis testing would include a thorough assessment of the patient, probably send the patient for chest x-ray, will be ordered to rule out pneumonia, and there will not be any need for any lab at this time. And the non-pharmacological treatment will be to monitor patient signs and symptoms for any worsening cough, any chest tightness, chest pain, and any shortness of breath. Patient will be monitored, and will also educate patient on the importance of increasing fluid intake and to use humidifier or mist when sleeping at night. And for pharmacological treatment, will include Tylenol, 325 milligram PO every 4 to 6 hours as needed for pain or fever, and dextromethorphan 20 milligram PO every 4 hours when needed for cough. We also educate patients, about the diagnosis and why they are having their current symptoms, as well as to educate patient on possible pneumonia if symptoms worsen. So, and I will also educate patient on smoke cessation, and I will let patient know that smoking can worsen the symptoms, and it can irritate and make symptoms worse. So it's important to refrain from smoking until symptoms is no longer there. Patient also will be informed that symptoms could improve in the next 7 to 10 days. So there will not be any need for any referral at this time, but I will have patients to follow up back to the clinic in the next 48 to 2 weeks time. So patient to follow up within the next 48 hours to 2 weeks if symptoms have not improved, for the possibility of starting the patient on antibiotics. And patients will also be instructed on how to manage symptoms as well. So that is it for my case study. Thank you so much for listening to my case study tonight.